Back with us is the guy that can always keep Rebecca and I apart long enough to talk some sense into both of us. And his name, of course, is Gary Dierenfeld. He's our social worker. He's your social worker. And he's back with us this Sunday morning. Happy Sunday, Gary. Welcome back.
Thanks. And I just need to let you know, my wife has a sweet potato and coconut milk soup on the go.
Oh,
that I can't wait to get into.
What time is dinner? We'll be there. I'll bring bread.
Your show is Sunday brunch, and I got to tell you that in honor of that, as best as possible, we like to be having a nice meal.
Wow.
I think that's wonderful. Save a little bit in the bottom of the pot for us because we're coming over right at 12 noon today.
It sounds heavenly.
Gary, an interesting topic for discussion today. One that, a lot of people will probably find fascinating, asking the question, can counseling actually have negative side effects? Can it?
Yeah. In the medical literature, it's referred to as an iatrogenic effect. An iatrogenic effect is a side effect, and it could be good or bad, but typically we're referring to the bad ones, of otherwise a good medicine or intervention. And in counseling, there can be unintended negative consequences as well that many people don't realize. They treat counseling like it's water, that at worst, ineffective, nothing, and at best it helps us for problems. But the truth is, counseling, like any intervention, can have these unintended negative side effects.
What kind of things can happen? What kind of iatrogenic effects can occur?
Well, let's start with the fact that counseling is still stigmatizing. Yes, I know there's a lot of campaigns destigmatizing counseling and mental health.
Really, it is in this day and age?
The reason we have those campaigns is because this is still a problem.
Wow.
And so for people who come to counseling, while the counseling may help with the problem, the side effect is they may still feel bad about themselves. And so in feeling bad about yourself, you may want to keep that counseling secret lest you be concerned about how somebody else reflects upon you for having attended. And secrets can actually get in the way of relationships, even a secret about counseling. So that's one. In other circumstances, a lot of people go to counseling on an individual basis for matters regarding a marriage or a relationship.
Right.
Now, the problem with that is the counselor will only ever be privy to a one-sided account of the situation. And most counselors are trained to be supportive, not necessarily confrontational. So the counselor may inadvertently support the distorted view of the person coming to counseling. And some people say, well, I'll bring my partner in, after I've met with you first. That doesn't work. But the person who comes in second, they feel one down, as if the counselor is, and likely is, already biased in favor of the person seen first.
Interesting.
So that doesn't bode well for couple counseling.
And I would imagine, Gary, too, that it has the potential to change negatively or increase negatively the dynamic between the couple at home, too, because you're going to this counselor.
On an individual basis for a couple issue, we can, inadvertently increase the risk of a separation. And, if you're coming here to improve your relationship, you certainly don't want to be doing that. Another area where we see these iatrogenic effects is between separated parents, where one parent takes the children to a counselor. Well, you got to know from the child's perspective, whichever parent takes you to the counselor, you're likely going to feel biased in favor of that parent, and you don't want to say anything disparagingly.
Right.
And you know that parent doesn't like the other parent. That's why you're going to counseling. And
Wow.
so the child in this circumstance is likely to say things to the counselor aligning with the parent that brought them against the other parent. These matters then get used in custody access disputes. Parents shouldn't be bringing children to counselors on a one-sided basis if they are separated. Both parents have to participate, even if one has full decision-making authority.
Do the courts take that into consideration, though, what you just said? That are they wise to that? Has your profession communicated that to judges?
Some judges, it's not overall court system, we got to look at the individual judge.
Right.
And some judges are aware of that dynamic, and some are not. And so the judge can be inadvertently influenced by the report of a counselor who's met the child only brought by one parent. And that does not make for a good outcome, as you can well imagine.
No, and it must be hard on you as therapists, as counselors, to be able to, like, you're hearing one side of it. You have to take a step back.
Right. So it's hard to maintain balance as a therapist counselor in that situation. You know, I do custody and access assessments as well as counseling for a living. And I got to tell you, it makes me livid, those counselors who will see children on that one-sided basis, because almost always it actually increases the conflict to which the children are exposed,
right,
for which they're seeing counseling for in the first place.
Wow.
So that's, I mean, I'm kind of stymied here,
me
but
too, Gary.
So the lesson in all of this is counseling, by and large, a good thing. Yeah. But make sure that the
counseling is suitable to the situation.
Right, and apply a specific criteria to that situation, and for lack of a better way of putting it, a set of rules to...
Yeah. Yes, and other circumstances. Jamie, you and I have talked about depression in the past. We've talked about cognitive behavioral psychology, cognitive behavioral therapy. It's a very potent, very useful therapy for depression. Now, if you go and see, quote, an inside-oriented long-term psychotherapist for depression, odds are you're not going to see the kind of relief that you would from cognitive behavioral. So we need to know what the problem is, so that we can better match, better attune the therapy of choice to that problem.
How do you know when you've had enough counseling? You know?
You know what? You know when you've had enough when you feel relief, when the problems for which you sought help for dissipate. I'm no longer depressed. I'm no longer, dragging my heels, feeling gloomy. The conflict between myself and whoever else to some degree has resolved. I've learned new ways to cope with unremitting conflict such that I don't feel overwhelmed, overburdened. This is how we know. And, the good counselor, the good therapist, will set some specific goals, whether they be about how you feel, what you think, or what you do, so that we can measure success, we can measure improvement against those goals.
Does the counselor ever cut people loose? Does the counselor ever say, okay, I think you're good, you can carry on? Or is it always the patient who has to say, I'm ready to go?
Oh, don't get me started.
We've got about a minute left.
We do this for a living. Yes, we want to help people get better, but we do this for a living. Some counselors are going to have to worry about their referral base, and are they seeing enough persons in order to earn that living? And that can create a conflict of interest, another iatrogenic effect, a conflict of interest where a counselor may seek to keep somebody in counseling a little longer than what the person might need, more in one's self-interest for the revenue than in the client's clinical interest. So these things can happen. So, yes, I happily let my clients go, whether or not I've got someone else to take their place. I'm, seeking to act in their interest. And actually, I make it explicit when I work with clients that I'm actually more apt to let a client go than a client is to want to necessarily go.
Right.
For me, those issues have always been the same. People really aren't working in counseling. They're just coming and complaining about their issues.
Right.
I take the view that I'm not here to just register your issues. I'm here to help you resolve them. And if I'm not doing that, I have no business taking your money. That's acting in my interest, not yours.
Right. So, Gary, we're right out of time. How do people get a hold of you?
Go to the website, yoursocialworker.com. Soup is cooking. You got to go. We're all good.
Happy Sunday,
all
Gary.
Right. Thanks very much, Gary. As always, take care.
Bye, guys.
Right,
Thank
bye-bye.
you.
There's Gary, and most of the time I land in the soup, at least where Rebecca West is concerned. We'll come back.
Spill it on your bib.
On my tie, exactly. We'll come back with more Sunday Brunch here on AM 900 CHML.